Anatomy and Physiology, Human Body Basics. Structure and functions, the meanings. Anatomy, the study of the human body structure. Physiology, the study of how the human body structure functions. Standard anatomical position. Standard anatomical position. The body is upright, the legs are close together, feet are flat on the floor, arms are close to sides, and the head, toes, and palms are facing forward. Anatomical terms of direction. Anterior or ventral means front or belly side. Posterior or dorsal means back side. And some examples are my sternum, which is my breastbone, is anterior to my spine, and my spine is posterior to my sternum. Okay. Superior, which means closer to the top of the head. Inferior, which means farther from the top of the head. And some examples are, my nose is superior to my heart, and then my heart is inferior to my nose, because my nose is closer to the top of my head. It is superior, and my heart is farther from the top of my head. It is inferior. Medial, towards the midline of the body. Lateral, away from the midline of the body. So, let's see. My fibula is lateral to my tibia, and my tibia is medial to my fibula. Okay? Bilateral. Bilateral just means relating to or affecting two sides. Proximal, closer to the connection to the body. Distal, farther from the connection to the body. So, the shoulder is proximal to the hand. The hand is distal to the shoulder. Okay? Superficial. Superficial means closer to the surface. Deep. Deep means farther from the surface. So, my skin is superficial to my muscle. My muscle is deep to my skin. Okay, and then right on the right side of the body and left on the left side of the body. Anatomical, two major regions. We have the axial region, which includes the head, neck, and trunk or torso area, including 80 bones. Then we have the appendicular region, which includes the arms and legs, including 126 bones. And I have the axial region in blue in the picture, and I have the appendicular region in pink. Axial region. Abdominal, which is the belly. Axillary, which is the armpit. Cephalic or cranial, which is the head. Cervical, which is the neck. Facial, which is the face. Inguinal, which is the groin. Pelvic is the end of the trunk. Thoracic, which is the chest. And umbilical, which is the navel. Appendicular region. The brachial, which is the arm. The carpal, which is the wrist. The cubital, which is the elbow. The femoral, which is the thigh. The palmar, palms of the hands. Patellar, which is the knee. Plantar, which are the soles of the feet. Tarsal, which is ankle. And I have everything highlighted in yellow in the picture for the appendicular region. Anatomical planes. Sagittal. Sagittal separates right from left. So in the picture, it just has a separation of your right side from your left side. Transverse separates top from bottom. So in the picture, it has a separation from your top to your bottom. Frontal or coronal separates anterior from posterior. So separates your front from your back. Abdominal quadrants. You have your right upper quadrant, your left upper quadrant, your right lower quadrant, and your left lower quadrant. It's pretty simple. Anatomical positions. Supine, anterior facing up. So in the picture, she's facing up. Prone, anterior facing down. So the body is facing down in that picture. Okay, anatomical cavities. You have the dorsal cavity, which includes the cranial cavity and the vertebral cavity. The cranial is the brain, and the vertebral cavity is the spinal cord. And then onto the thoracic cavity, you have your pleural cavities, which is your lungs, and your pericardial cavity, which is your heart. Then you have your abdomen pelvic cavity, and you just have your abdominal cavity, which is your digestive organs and spleen. Then you have your pelvic cavity, which is your urinary bladder, rectum, and reproductive organs. Okay. And these are just more cavity labels that I did not have on the other picture. So I added the mediastinum, and I added the left pleural cavity,